The Louisiana Public Health Institute and Healthy Blue announced the opportunity to apply for the first cohort of the Racial Justice and Health Equity Learning Lab at the closing of last year's Racial and Health Equity Symposium. Through an application process, we selected a group of 30 leaders from across the state as the first cohort of participants who are committed to taking their leadership skills to the next level and partner up for lasting change in our state. The Learning Lab was a 6-month cohort program that consisted of a combination of training and networking opportunities throughout the duration of the project. We had several objectives, but the primary one was to integrate principles of equity and racial justice into all elements of their leadership practice, including developing personal, institutional, and structural level approaches to equity. Over the 6 months of the training cohort, there were 2 cohort meetings for team building, and then we did 4 training sessions on the ADJUST curriculum from the Michigan Public Health Institute. And ADJUST stands for Advancing Justice Together. By the closing of the Learning Lab in November of 2021, there was an opportunity for participants to work in teams to develop applied community projects, to apply and practice what was learned during the Learning Lab. There were 5 ideas pitched by the cohort to a panel of external judges for the opportunity to receive $25,000 mini grants from Healthy Blue. 2 were selected and are currently receiving technical assistance from LPHI and the Michigan Public Health Institute through June of 2022 to successfully implement their projects.
We held a lot of brainstorming sessions with all team members, and it was suggested to focus on the BIPOC LGBTQA+ community. Health disparities in this population have been overlooked for a long period of time. Our goals are to build a healthcare provider network that is more equipped to address the wide array of health disparities that are pervasive with these 2 communities. Also, a listing of BIPOC and LGBTQIA+ informed providers. Also, workshops being led by those who are either a part of this community or well versed on the topic at hand as it relates to the intersectional identities of these 2 communities together.
The focus of the Elite Equalizer project is to improve access to culturally competent and effective mental health art therapy services for New Orleans residents who traditionally don't have access to this modality of therapy due to their insurance status or other identified barriers such as lack of transportation. Specifically, we're focused on providing art therapy services to culture bearers, expecting or new parents, and senior citizens in New Orleans. So success to our team looks like delivering as many as 120 individual art therapy sessions to the target populations in New Orleans.
We are grateful for the participation of all the participants for the first cohort of the Racial Justice and Health Equity Learning Lab. We look forward to their continued impact from what they have learned.